A bill like this was just introduced in Wyoming, and now one has been introduced federally by Representative Andy Biggs of Arizona. This is the Ultrasound Informed Consent Act requiring providers to ultrasound patients and force them to look at it before they can get an abortion, even though that is not evidence-based, it is not medically sound, it is not medically necessary. I think this is an important time to highlight what the Journal of Ethics has to say about these type of laws. Ultrasound, either abdominal or transvaginal prior to an abortion procedure, is common practice. However, it is not medically necessary and can add to the cost of the abortion procedure. I will also add it can add to the ability to even access abortion, as a lot of people live in rural areas where they cannot come in. This is basically a ban on telehealth abortion. Do women undergoing abortion want to view the ultrasound? A recent study of patients at a large urban U.S. abortion center found that 42.6% of women desire to view their ultrasounds. No studies have examined the impact of mandated ultrasound viewing, but given that 57% of patients in a recent large study did not want to view the ultrasound, one might conclude that required viewing interferes with the shared decision-making model typical in the patient-physician relationship. There were 2 small studies also done. Both demonstrated that women appreciate having the option of ultrasound viewing. The option. That is the point. And women who viewed their ultrasounds before first trimester abortions continued with abortion at the same rate as women who did not view the ultrasound. More recently, there was one additional study that found that women who are less certain of their decision to have an abortion might be more likely to continue their pregnancies after ultrasound, but that the majority of women opt to terminate after viewing the ultrasound. Most of the literature on ultrasound viewing demonstrates that women would like to have a choice about whether to view the ultrasound, and that ultrasound viewing is not conclusively linked to the decision to continue a pregnancy. So this is requiring that women receive an ultrasound, even though it is not medically necessary and would limit their options and ability to access care. Also, it's important to note that within the text of this bill, they are redefining what abortion is. They are saying that the term abortion means to terminate the pregnancy with an intention. So now they are redefining abortion as an intention, other than to produce a live birth, or to remove an ectopic pregnancy, or to remove a dead unborn child. Remember, some miscarriages still have heartbeats, or a criminal assault on the pregnant female. This bill has a lot of issues with it. They are playing around with medical definitions that they don't fully understand, as well as barring people from accessing care.